the sports surgeon field will be arthroscopic surgery, right? Yeah. You make small incisions, mini invasive surgery. So a bit of by accident, I slipped into arthroscopic. Then I have a background. I was an athlete when I was young, so I was always big interest in sports. And then, you get some athlete patients, and then things, just rolling on. So it's not. It's a combination of let's say, combination of just randomly it happened, and also my interests, of course. Sports, maybe 10 to 15 years, I think now. 10 plus years at least it is. Track and field, I was a high jumper, See, I had some overload injuries, right? But not like an injury, like an ACL injury or a knee injury like this. But I had problems, yes. And the problems led to that I stopped when I was 18, 19 and just finished and got tired of it. So it can be something that, because in that age between 15 to 20, lots of things are very interesting for you, right? Not just sports. So injuries can actually be something that, okay, no, I'm not going to play anymore, whatever you're doing. So in Sweden, I did a fellowship in arthroscopy, sports medicine and research in Cape Town in South Africa. This was 10 years ago. And then I practiced in Sweden, and then ended up here in Maldives since 1 year now. Yeah, I think there are two levels of sport injuries. One is the semi-professional or professional level, the higher level of athletes. They will occasionally get injuries, but also they have lots of overload problems, like overuse or overload, because being an elite athlete, you're always pushing the borders of what your body can do, right? So that's one group. The bigger group is actually all the people who are recreational sports. And I noticed that playing, as we discussed before, people will play in very high ages. In my country, nobody's playing after maybe 30, 40 years. Here, they will play as long as they can, right? Which is a very nice thing. But it also means that knee injuries is probably the most common. Knee injuries, ankle twists, this kind of injuries you see a lot. And some people will come to me with a knee injury and they say, okay, I want to do the surgery, and I say, okay, because I want to play again. That's even if they're 45, they say, I want to play again. So they really love their sport. So football for sure. So that's something we see. I think the one who's playing football, they're kind of aware because they always have a friend who's been doing this and so and so. But not always. But when you see a patient like this, you really, before you proceed with surgery or anything, it's my job to really inform the patient properly to understand that I can only do my part, which is to do the best operation possible that I can do, possibly, and you have to do your part, which is doing the rehab, for example. And also, say, example, you cannot play for, let's say, 6 months or whatever, depending on the injury. No, but the elite level athletes, they are a different breed, right? Because the first question for them will be, they will usually be, when can I be back, and how long is this going to take, right? And they're also the ones who are pushing the borders, so you can learn a lot from them. But also, usually you have to keep them, holding them back, because they have a tendency to be too good in doing rehab, for example, and maybe for like normal persons, you have to push them a bit to make sure that they're really following the rehab protocol afterwards. So, but my little gratitude is that if you have a high level athlete sustaining a serious knee injury, for example, if you can do surgery and everything is well and they go back, that's very rewarding, especially for them, but also for me. Right? Yeah, I see them back in the field and they're very happy with the knee function, and we can see that everything is working out for them. So I think that's something, but I also see cases here not with elite level athletes, but other athletes that come with injuries, and usually they will come several years after the original injury, right? So this is also a bit of awareness, of course. I would claim the opposite, that my experience for sports injuries, that the volume sports injuries is just for normal people who is playing for fun or for just recreational, and then you have the elite ones. They're just a few ones. But as I said before, these are the ones that pushing the borders, and you can learn from them. But most of my patients are just normal people playing for fun with their friends in the weekend, for example. So I think sports medicine is for everyone. It's not just for the elite ones, of course. We have facilities to take care of almost any sports injury here. I mean, ACL injuries is a common injury, especially in playing football. And there are several Maldivian doctors, and also me, who's doing this and been doing this for many years. I also focus a lot on shoulder injuries. Shoulder injuries, there's not so many doctors working with shoulders here, but we have all the facilities. I can take care of any shoulder injury here. So very rarely from treetop with sports injuries we will send someone abroad, I'd say. I think that's alternative treatments, but also I notice it's a cultural thing here that they will come to me and this is my suggestion, you should do this and this surgery, whatever it is, and then they will maybe go and see someone else, or when they come to me they've seen one or two doctors before, and so they're always seeking for several opinions, right? And I don't think it's so common that they will seek alternative treatments, but some of them went abroad on their own. Some of them seen other doctors, and it's a small country, so word by mouth. It's also, my neighbor was seeing you, so he suggested you should come and see me. So this is also a way of coming here. But I think also it's important to stress that most of the injuries, sports injuries, are not treated with surgery, right? Surgery, of course, is a tool that we're using when it's needed, but most of the injuries always involves physiotherapy, right? And we have a big physiotherapy department here as well, so we can take care of them. But physiotherapy is always a part. Even if you do surgery, physiotherapy is extremely important, right? I would say ligament injuries, ligaments are almost always involved when we're talking about sports injuries, right? That can be a twisted ankle, it can be a knee injury, but also the shoulders, like we also call them soft tissue injuries, right? And in that I also include this overuse or overload problem, right? So people will go and they will play a lot of badminton and they will come with a painful elbow, for example. This is a clear example typical example of a overload or overuse injury. I will send lots of patients and we agree on surgery, and then they never show up, right? So I think and quite often also they will, I think that's a good thing, they will come, we'll make a plan for them, and then they say, okay, I will come back, I'll just go home and discuss with my family. This is very different from where I come from, right? So, which is a good thing, because then they have the support of the family if they're going for a surgery, for example. First of all, traditionally, you did what we call open surgery. You make a big opening, incision to the skin, and then you did something, let's say for the knee. Then when we started with mini invasive or arthroscopic, you just make an incision maybe 1 centimeter, a couple of these incisions you can do in the shoulder and knees or any joint actually. This means you put in a camera and then you put the picture up on a big screen like a TV. So the vision is much, much better. You see so much better and you see so much more when you're doing something with minimal invasive. For the patient, it's also, they will have less scarring, less pain, and there's less risks of complications like infections and things like this. So that's some of the advantages with so open surgery for soft tissue knee injuries or shoulder injuries, it's not done anymore, I think. This is the modern way of treating it. Parallel to this, there's also been an extreme development in instruments. Instruments are crucial, right? Because my hands are outside the body, right? So the instruments will be inside the patient, and they're like extension of my hands, you can say, when you're doing the surgeries. It's amazing. People are very nice, very friendly. The climate is excellent. It's a very beautiful country. But of course, it's also very different. This is a Muslim country. I'm coming from Western Europe. But that's also part of the adventure or the challenge for me, right? I mean, seeing patients, treating patients, it's the same. They will have the same problems as anywhere in the world, I think. It's just a matter of culture. That's the different things, right? People will, 95% of my patients will come with a bystander, right? So there's always 1 or 2 people joining them. This is, I think, a cultural thing. My country, usually you go to the doctor on your own, unless it's something very serious, right? This is one difference. And but also I have my wife and our youngest daughter is here. She's going to school here, so I have my family here as well. So yeah, it's good. Yeah, I'm playing tennis here. Yes, I do. So I go to Male 3 mornings, 6 to 7 in the morning, playing with a group, together and a coach, so it's very nice. And I've been participating in a couple of tournaments as well. I'm just a recreational player, but really enjoying. And I think it makes me happy if I go out in the morning, go to the gym or take a power walk. And I'm meeting lots of people jogging, walking. And I think this is also something for the future for the Maldives, that more and more people, every day I have discussions with my patients telling them, you need to start doing regular exercises. You can do whatever you want, swimming, walking, running. I think this will become more and more important in the future for the country. So running, let's take running as an example. If you start, you say, now I'm going to start exercising, and you go out for a run, there is a fairly high risk that they will develop some problems, right? Depending on who you are, but let's say you have a couple of extra kilos carrying on and you start running, then it's a high risk that you will develop some knee problems, right? So the intention is perfect, but in the ideal situation, people need to combine jogging, if you take that as an example, with other exercises, like strengthening exercises, going to the gym, or doing just exercises on your own, right? Swimming is lighter exercise, but I prefer, if people are active and doing exercises, it's perfect, right? Injuries will come, but sometimes you need to guide them and just do this instead, and things will work out for you, right? It's extremely important. If you're just staying in one place and just doing whatever you have been doing, you will be left behind, because the development is very fast, and there is new things coming, new procedures is coming. So I think that's for any orthopedic surgeon. You need to go to conference on a regular basis to just stay updated, right? I've been fortunate enough, so I've been invited as a faculty to talk about different topics in sports, like ACL injuries or shoulder injuries like this. So I think shoulders is maybe something I can contribute to the knowledge in the country, because there's not so much shoulder surgery here. So, and I think there's lots of people with shoulder problems that needs help and can be treated in a proper way. It's very common. It's not. It's the second joint after knees. But shoulder injuries is if you have an injury to the shoulder, there is two injuries that's the most common. One is that you dislocate your shoulder. That's most for the younger, active ones. And if you have recurrent dislocations, this is something that might be treated with surgery. Second, also very common, is that you have a tendon injury. It's called a rotator cuff injury, also very common. So I see a lot of patients with rotator cuff injuries. Most of them don't require surgeries, but some of them also, if you have an injury and you have a tendon rupture, might require surgery as well. And these patients we can now take care of here at Treetop instead of sending them abroad. That's one thing. Then a big group of shoulders are just painful shoulders, right? They will come in pain. So swimmers, for example, they have a tendency to develop shoulder pain, if you're going to talk in sports terms. Motorbikes contribute to a lot of injuries, also twisting knees and ankles and shoulders, right? So, yes. The PhD thesis is about shoulders, or actually shoulder arthroplasties, which is similar to when you do an arthroplasty of the knee. Arthroplasties we cannot do here in the Maldives currently. The volume is too low. To do an arthroplasty for the shoulder it's not as common. It's maybe 10% of the amount of knees, right? So as of now, it's not here in the Maldives. Maybe in the future it will come. But the PhD thesis is also about you making your thesis as a proof of, okay, that you did your scientific work, and it's like an education as well. Scientific training or scientific certificate that you're, PhD. I have contact with a few. I have a colleague at ADK. He's also doing some shoulders. We have there's an open climate, I think, and he will send me patients and ask me about opinions. And I think that's also for me to, whatever I can, that the knowledge is not that high in the Maldives, and I think that goes especially for shoulders. Maybe my vision is at least that we can implement some of this here, and the Maldivian doctors can also perform this in the future. Maybe I'm not going to stay for the rest of my life, but so maybe I will leave something behind in terms of knowledge. I think the shoulder part is quite important, and also the part with I think we should differentiate between, as you said it very well, in terms that, okay, we have people think that sports injuries is just for elites, right? And I would say turn it around and say most sports injuries is just for any person, right? Then we have the elite athletes, of course, but they're just a small part of the sports injuries. Sports injuries is for everyone, I'd say. So if you go and play football with your friends and you have a knee injury, that's a sports injury, isn't it?